Deb, we've been talking during the break. You were talking about folks moving to this area since we have so many retirees, as we've noted, that a lot, once that job that they've aligned themselves with and actually see themselves as is removed, that depression may set in.
It can, because, you know, when you introduce yourself to someone, you know, the second thing you say beside your name is, what do you do?
What do you do?
You know, I'm Deb Way, I'm an occupational therapist. There you go.
Yeah.
So when you retire, you have a change in role, you have a change in your identity, and you get involved in your retirement activities, and then you have a health issue, or your spouse has a health issue, or a child, an adult child can have a problem. Then you see big shifts occurring, and it can lead to depression. And one of the things that we offer is we deal with the depression and the grief of the loss of role, of function. Say you have a heart attack or a physical illness and you lose function. You grieve.
Sure.
You grieve very hard for things like that.
It's not supposed to be this way.
That's
I worked
right.
hard my whole
That's
life,
right.
and now it's supposed to be my time, and this isn't fair.
That's true.
Yeah.
Yeah. So we do that. We have those kinds of clients that come to us, and we do cognitive kinds of therapy with them, kind of here and now, and how to cope and how to regroup. Sometimes.
And do you do this through activities?
We do activities. We do talking groups. We do individual structured things like journaling. Some of the younger, older adults that we see on our floor, we start them on a journaling program where they begin to journal their thoughts and their feelings. And then we're able to go back and look at it differently. You know, if all I do is chase a negative thought in my head, it grows and it's big and it's unmanageable. But when I say it or write it, take some of the sting out.
Sure.
And put you back in a different kind of coping mechanism.
Right. Do you do with your activities, I'm just curious, any music therapy?
We do.
Okay. I've always thought that
We're
was
blessed
just,
that we have nurses. We have one or two, I know, that
We have one nurse that plays the piano.
Oh, wonderful.
We just recently have started trying to bring in people like Bev, our new activities coordinator, just got one of the activity coordinators from a local nursing home to come to the unit to play the guitar
Oh, nice.
and sing. So that was really good.
Yeah.
and we're very fortunate to have a therapy dog, so we're actually able to offer pet therapy, which is extremely
Oh,
calming.
yes, absolutely. You bet.
You know, it's
Yeah. There's
healing.
nothing, yeah. Is it a little white one?
No, it's a little gray.
A little gray, okay. 'Cause I was thinking we had a woman that came to the health fair last year, had a therapy dog with her. Really sweet, just sweet, sweet dog.
I know that dog that goes to the nursing home. So
Oh, okay,
I know that
all right,
one.
okay,
Actually,
okay.
our social worker, her dog is a therapy dog.
Oh,
So she-
wonderful, yeah. I know I've been at various facilities where they used to have rabbits too. They had the little lop-ear rabbits,
Yeah.
and they're just so soft. And they would bring those with them as well, and that's great. And I love the idea of the music. With,
Oh, I do too.
I always think back to a woman that, with her dementia, could not have told you what she had done or had for breakfast 5 minutes ago. But she used to play piano when it was just the talkie movies. I mean, that's how long ago this was. She could remember every single piece of music
Yes.
that she had learned and
Yes.
play the piano. So the long term was absolutely intact. And so she'd start playing. Well, that kicked off memories for other people that were there. So, I mean, it
Right.
was really a very enjoyable afternoon for
Right,
everyone.
right.
So,
And that's the benefit of treating people in a group setting the way we do, because the same thing that you're speaking of happens on our unit too.
see, that's wonderful. Yeah, yeah, they've got all that nice long-term pleasant memories, and get rid of this anger that
Yeah.
they're holding in the here and now that
Yeah.
can't do much about,
No,
except get rid of it. Try and get rid of it.
that's
So.
true. It's
Yeah.
very hard. It's a very hard process.
What kind of structure through the day? I mean, are meals?
Oh, everything is structured.
very structured.
Our meals come about a little after 7, Then at 8:30, we start rounding where we see all the patients, and the activities are also going on at that time. So we do an exercise group, we do a nutritional group, and during that group, we talk about planning your diet, and we're choosing from what the hospital offers. It's a way to engage and empower people to make decisions. Then we go into a activities group more focused on the completion of something. You know, Bev offers a variety of things there. And then lunch. Then we have our visiting hour between 1 and 2.
Okay.
And then after that, we usually have a little quiet time after the families leave. Gives people a chance to process having seen their family and them leaving. And then we start our evening activities. Might be music, we might as a group select a movie. You know, people might at that time wish to make phone calls because they've talked to family. They have a different idea of what their plans are, so we don't make calls for them or make their plans for them. We encourage them to be independent of us, and we encourage them to make those decisions. Now, Joy, the social worker, and based on what Dr. Foster recommends, we'll schedule their follow-up sessions. But like if you need certain things done, then we just give you the tools to do it.
To do it, right. So we're changing, if I'm hearing this correctly, then we're changing much of the behavior once it's determined that it's not medical, through medication in many cases.
And
You're
structure.
And structure, okay. Well, what can be done then? Are you seeing Alzheimer's patients?
Oh, yeah, that's the
Okay.
most common type
That
of
is
dementia.
dementia?
So
Okay.
that's the typical
Yeah.
dementia patient we see.
Okay, so, and some of that behavior, are you seeing sundowner syndrome? And so you've got different things going on in the evening as well?
Right,
and,
so
yeah.
typically with the patients with Alzheimer's or other dementias, they sometimes get worse in the afternoons and in the evenings, and they stay up all night and then sleep during the day, and sometimes people call it sundowning, like you said.
Yeah.
And so obviously that's problematic at home a lot of the time.
Yeah. But would that be, if we use that as an example, then that would be when you would, because that's not a behavior you can change, is it? At this stage, or is
to
it?
some degree we can.
Okay.
Sometimes the medications can help with that, sort of
Okay.
normalize the sleep cycle and decrease some of the confusion in the afternoons. And so the medications can help with that, and obviously the other things we're doing on the unit can help as well.
Sure, sure. And then really educating the family as to what to do.
Right, how to
Okay.
manage these
Yeah.
behaviors.
Yeah. Is redirecting still one of the big ones?
Oh, absolutely. Yeah.
Redirect,
Right.
redirect, okay. And that's a huge thing to learn. I mean, that's I know years ago what a great thing that was to learn, to be able to take a situation down,
Right.
de-escalate everything by redirection. So, but boy, you guys are busy up on that floor then.
Yes, yes.
How many beds are on that unit?
19.
19. Okay, that's a nice number to
Mm-hmm.
have in your group sessions and have in your activities. Not too big. And of course, that would be different times for different folks, probably.
It would,
yeah.
and sometimes the ones that occur concurrently, Joy will have a few, I'll have a few, or sometimes I may have one, and then Beverly might be doing an activity with a couple, and then Joy would have a group. So, you know, what Dr. Foster started with on the individualized treatment plan, we try very hard to come up with the best plan for the intervention for the individual.
Right. Right.
And sometimes it flows beautifully, and sometimes you just have to step back and go, okay,
Yeah.
we got to regroup here.
Plan B.
Yes, yes. And that's the
Yeah.
beauty of working
Sure.
in such a good team. The nursing staff is dedicated to the floor. This is what they do. They do lots of education with our patients and families.
Yep.
You know, Dr. Foster has oversight of what we do, so
a
we have
good doc.
someone that we can go to, you know.
Yes.
So that all of that together makes this team work very well, where we know how to step in, and like if a patient does not like me, or I remind them of someone and things are going bad, well, I need to back out and somebody else needs to move in. And we do that. Seamlessly, we flow.
Right, and understand, and you never take it personally. It's like, because it's
Yeah,
not. I mean,
it's
it just.
not personal.
Yep, whoops, okay, let's try, go the other direction. You know, I was thinking too, something to share with all the viewers here too, is that they've not seen the unit itself, is so bright and light and beautiful. It's like coming into a big, just a big open space that you know, you come into, and there may be activities over here and a group that's talking over there, but it's
Right.
just so bright and welcoming. There's the
It
word,
is.
that big word I needed. Where was it today? Welcoming. It just is. When you walk in that unit, it's so nice.
And one of the things that we're working toward is to put a virtual tour on BRMC's website. So when people are exploring what they need, and they can click on that and they can see
Great
the
idea.
unit. Because, you know, historically mental health was like dungeon and dark and hidden away,
Right.
and there's scary people. That is like
Yeah.
so not true.
Yeah.
Our unit has big open windows, it's
Yes.
bright,
And
it's cheery.
Yeah, and I think every person I've ever met that said, I don't want to go to a nursing home, okay,
Yeah.
has visions of people sitting in wheelchairs all up and down the hall drooling. And it's
Right.
like, no, that's not what it is anymore. It's changed. And the same thing absolutely
true.
for a mental health unit. Yeah, it's not, it's lovely. You,
And we have great views.
Yes, we do.
Yeah. Yes, you do up there. So I know. Now, does everyone have a private room? Okay.
And a private bath.
Beth, which is great from a dignity
Yeah.
standpoint, from a being comfortable. I'm sure that's what they have in their own home, and so this is just a continuation, just in a different location.
Right.
So, well, I have absolutely loved having you all on the show today. I want to thank you all for coming out. That's once again, how can they reach you?
870-508-6400.
And that will get you to
Straight to the unit, and we're
Okay.
open 24/7. No matter who answers, we can all provide the information.
And you can do the direct admits
Right.
now, which is wonderful, from clinics,
Physician's office,
nursing homes.
Mhm.
Okay. And if all else fails, come on down to the ER.
Right.
And
And we work very closely with ER, so when a patient comes in, they call us immediately if they've assessed and know this is going to be a behavioral health. So we're able to go down, we're able to gather the information and streamline their time in ER, because mental health patients really don't belong in the ED. That's
Yeah.
just not what it's there for.
Right, right.
So we're
And-
trying to figure out a better approach.
Well, it sounds like you've done that. So good for you guys. Come back and see us again soon, okay?
Will
Thank you
do.
for
All right.
having us.
Oh, we're delighted to have you. And thank you for joining us today for BRMC's Healthy Connections.